This presentation is sponsored by Griffith Allied Health Clinic for Physiotherapy, located on level 4 of the G40 building on the Gold Coast campus. This presentation outlines the signs, symptoms, and treatments for urinary incontinence and how this clinic can help you gain back control over your life. So let's start with what is urinary incontinence. Essentially, it's the unwanted leakage of urine. It can be a small dribble to a total loss of bladder control. It's mainly associated with any kind of pressure changes within the abdomen. So it can be associated with sneezing or coughing, jumping, running, abdominal exercises like crunches, an urge to urinate, and it can even occur after urination. When we think of urinary incontinence, you might hear not many people have urinary incontinence, or only women get this after childbirth, or it's a normal part of aging, it's bound to happen, you can't help it. The thing is, these are all false. 65% of the Australian population will have urinary incontinence at some point in their lives. That's a lot of people. And it doesn't just happen to women, it can happen to anyone, including men. Although it is more common in women, that's 1 in 5 in women and 1 in 10 in men. And it's not inevitable or a normal part of aging. The thing is, urinary incontinence is common, but it is not normal and it can be treated. You shouldn't have to live with this condition. Analysing your symptoms may give clues as to what type of urinary incontinence you may have and the treatment direction. If you find you're losing urine during sneezing, coughing, laughing, and exercise, you may have stress incontinence. This can result from physical changes to the pelvic floor, like childbirth. If you have a frequent need to urinate, and there is a loss of urination when there is a need to urinate, you may have urge incontinence. Sometimes this happens when you can't quite get to the bathroom fast enough. If you have a loss of urine after completion of urination, you may have post-micturition dribble. This is most common in men. There are a number of risk factors that increase the likelihood of developing urinary incontinence. On this list, the ones in red, including obesity, constipation, reduced mobility, some medications, urinary tract infections, and diabetes, can all be managed by your GP, and this may be enough to stop the urinary incontinence. However, if this doesn't stop the urinary incontinence, further action must be taken. Conservative management, including physiotherapy, can significantly reduce or permanently stop urinary incontinence. The way the sessions will run was they usually go for 5 sessions over 4 to 6 months. First, the pelvic health physiotherapist will then assess your bladder function and your pelvic floor muscles. An appropriate pelvic floor muscle training program will then be devised. The way physiotherapy helps is it trains your pelvic floor muscles. The focus of pelvic floor muscle training is to build strength, endurance, speed, and the coordination of the pelvic floor muscles in different situations. So it helps you really stop that unwanted urine loss. So how does someone train their pelvic floor? You do it through pelvic floor muscle exercises. A good way to start is to gain an awareness of your pelvic floor muscles. A good place to do this is when you stop urination mid-flow. The muscles you use to do this are your pelvic floor. Once you have an awareness of where your pelvic floor muscles are, you can begin training. Sit, stand, or lie down with legs slightly apart. Relax the thighs, abdominals, and glutes. Tighten the pelvic floor by drawing the muscles inwards. For women, a mirror may help. For men, feeling the 2 sides near your hip bones may help. Try to complete 10 slow squeezes, then 10 fast squeezes. Repeat the exercise 4 to 5 times a day, or however many you can manage. Your physiotherapist will help you through these exercises and direct the amount and quantity. Simply voicing your issues to a health practitioner and receiving a quality treatment for urinary incontinence could change your life. So don't forget to book an appointment with a pelvic health physiotherapist here at the Allied Health Clinic. You can follow us on Facebook for updates at Griffith University Allied Health Clinic. I hope you've enjoyed this presentation and you've learned a little bit about urinary incontinence. And remember, you don't have to live with this condition.